90% of children with ADHD have a sleep problem.
Or you would consider that linked somehow.
Oh, yeah, it's absolutely linked. It changes your gut bacteria.
Microbiome.
The microbiome. Yep. It is leading to dementia, inflammation, depression, anxiety, schizophrenia, bipolar affective disorder, PTSD. The list goes on.
If a child mouth breathes a lot, their whole face becomes narrow and longer. You get this long facial pattern.
Get weird.
The chin tends to go back. Well, what happens when the chin goes back? Goes back in the airway.
They also don't get dates.
It shows up later as type 2 diabetes, heart disease, stroke.
Back in the 1800s, the scientific literature actually points out these things. They knew this stuff in the 1800s. This is not new.
So how do you fix it, though?
So
what it is, Brad Lee back again with another episode of Dropping Bombs. Today in the studio, folks. As always, I've got a real treat for you. Dr. David McIntosh and Dr. Bill Harrell in the house. What's happening, gentlemen?
Nice to be here. Thanks, Brad.
Just glad to be here.
Thank you. Thank you for being here. First of all, a lot of parents out there better pay attention to this. If you got children especially, or it could be afflicting yourselves. But Dr. David McIntosh, international ear, nose, and throat specialist, leading authority on pediatric airway and sleep disordered breathing, author of multiple books, including Snored to Death, mission-driven educator, connecting breathing disorders to ADHD, developmental delays, and long-term health consequences. In other words, this stuff can affect your kids, and it may have already affected you. Dr. Bill Harrell, board-certified orthodontist and professor at University of Alabama, Birmingham School of Dentistry, certified in dental sleep medicine, dentofacial orthopedics. Personal experience with childhood breathing disorders fuels his passion for early intervention. Expert in how breathing affects facial development and jaw alignment. Welcome.
Thank you.
Thank you again.
Thank you.
Now, the reason why I'm interested in this is because, obviously I have 7 children, 4 of which are already grown, but 3 are still young. Now, again, I had to call my wife to say, do they snore? Do they sleep? Do they breathe with their mouth open? Because I don't know. How do parents know if their kids are mouth breathers or doing this? Number one. Number two, big deal. What's the harm? What could happen?
Good starting point. So the first thing is that the only reason that parents would know about if their child is doing it is because they've actually seen and heard it. And that's unusual. It's really actually unusual that parents do know what's going on. And the next problem is they don't even know that they're supposed to be looking for this in the first place. So this is probably step one, is say, look, really easy. Children, they're not supposed to mouth breathe. They're not supposed to snore. Now, okay, if they've had a really big day, they're really tired, or they've just got a cold and they're a bit blocked up at the time, and that's just circumstance, that's normal. But if we're talking about a child that is doing this night after night, week after week, month after month, that's not normal. And how do you work that out? You've got to get out of your own bed and go and see what's going on in their room. You got to look and you got to listen, and you got to do it every night for a week or two. It's not a lot of time you need to do it for. You're not going to be there the whole night. Just a couple of minutes here or there. Just watch and listen. And if you spot it, write it down. Make a little diary of it. So that way you've got a record of it. And when you look back at it, you can go, oh, wow, actually, yeah, they are actually snoring or mouth breathing or both a fair bit most of the nights that, I've been checking on them. And if that's the case, that's our starting point.
What if their mouth's open but they're not snoring?
Still a problem.
So they shouldn't be sleeping with their mouth open.
Correct.
Because sometimes, I would imagine, their head gets in a certain way and their mouth just opens because they're asleep and they're not like closing it.
Okay. So that's actually a really good reflection point in terms of the head position. So hopefully a lot of your listeners are familiar with mouth-to-mouth resuscitation as a way of saving someone that's had a collapse, they've stopped breathing. Mm-hmm. And for those people that have done those courses, done that training, they will show and tell you as part of all that the head position's really important. Specifically, the head is pushed back. So parents might notice that their child sleeps with their head pushed back and their mouth open. That child is actually doing first aid, resuscitation on themselves.
Just instinctually?
To get through the night.
Open the airway.
Because, why can't they breathe with their head normal?
when you tip your head back, it opens the airway more. So if we've got a child that has a compromised airway to start with, they are fighting for space. And kids are survival machines. They work out what they need to do to get to where they need to be. And one of the things they work out just through trial and error and then success, tip the head back. I can breathe better. All right? That's our default position.
What's the harm?
Well, there's a lot of issues because they show what happens. Children are kind of adaptive, and it shows up later as, a lot of comorbidities that occur in adults, such as type 2 diabetes, heart disease, stroke, all these things. But in children, a lot of the bigger things is even ADHD. People think, well, my child's got ADHD and been diagnosed with ADHD. They need to have a sleep study. Because most of the children that have ADHD, they're probably not breathing properly at night. And snoring, you think about it, it's a noise. Maybe it as a couple, it's usually the man that's keeping the woman awake. It's affecting her sleep because he's sitting there making all this noise. Maybe she's having to wake up every so often and punch him because he stopped breathing. That's obstructive sleep apnea. That starts in children. You start seeing it as snoring. But as an orthodontist, now I'm an orthodontist, you go, what in the world is an orthodontist and an ENT physician sitting here together talking about? Because you think about orthodontics as just, hey, I'm going to take my child when they're 12 or 13, they got crooked teeth or an underbite or an overbite, and we're going to do this particular procedure. The problem is you're waiting too late. You have to see these things early, because a lot of these issues that tend to crop up in children, ADHD is, like I said, a main one. Even David would talk about this whole thing about autism.
But if we look at autism, we're still on the learning curve of understanding it, and it's not that it's just one thing. It's a multitude of things. There's some genetics that can predispose you to it, but then you have to have certain things happen. The reason that this flies into the ENT world is things as simple as getting ear infections needing tubes can bring out some autism issues. If your child is not breathing or sleeping properly, it can bring that out as well. And the important thing is when we look at this, what we're really talking about, autism, ADHD, we're talking about brain and brain development. So you say, look, why is this important? Why do we care? And the big reason for that is that when it comes to brain health, that equals airway health, because the way that your brain grows and develops is predominantly in your childhood developmental stages. The brain is on a rapid growth curve, and it's sleep that it needs to actually have that restorative element. It's the time where our body growth hormone is released in the mainstay. It's the time when all the toxins that have built up in our brain, basically it's like the street sweeper that comes through at night and cleans it all out. Those people that wake up with headaches and brain fog, very typical of those people that aren't breathing or sleeping properly. The children that wake up tired and cranky after what should have been like 10 hours of, in theory, good quality sleep, clearly wasn't. And it's also where memory is developed. So this is why these children show up with learning problems, so that they get flagged at school. Johnny's not concentrating properly. He's not doing very well with his reading and writing and math, and so forth. And then you end up going down the wrong pathway, completely ignoring the sleep. If we look at ADHD, 90% of children with ADHD have a sleep problem. Okay. That's pretty significant.
Or you would consider that linked somehow.
Oh, yeah, it's absolutely linked because this is all brain function. What we're doing right now, having this conversation, me moving my hands, you looking at me, this is all brain work. And this is all contingent on the fact that our brains have learnt to do certain things at certain times in certain ways. Just talking. When do you learn to talk? When you're a child. When do you learn to move? When you're a child. So as we go into the developmental stages of children, their brains are actually on a huge growth curve, and the brain needs sleep. But not just sleep in terms of quantity, it needs to be quality. If you can imagine, if you have your phone and it's ringing every 10 minutes through the night because a different friend is calling you saying, hey, I just wanted to say hi. And you're like, whatever. And then 10 minutes later, it's another friend. And then 10 minutes later, it's another friend. And they do that through the whole night. Your sleep has been so interrupted throughout that whole night. You're going to wake up and go, man, that was a really rough night. I'm putting my phone on silent tonight because I need to get my sleep.
What if you wake up and you feel great?
If you feel great, that's a good sign. It's not an absolute sign, but it is a good sign because there are certain people that can have these breathing problems that have some resilience. And the way I can look at that is, looking at analogies. We know that if people, are in a fist fight on the street, untrained, not professional fighters, they're going to get pretty beat up. Whereas we can go and watch two guys in a UFC ring and, they're smiling and hugging each other afterwards, even though they've just been through war. So there's a conditioning that can come about, but when it comes to breathing and sleep, that's more just intrinsic to the fact that you happen to get some good genetics that gave you some protective elements against these problems. But in the mainstay, most kids that are mouth breathing, most kids that are snoring, they are not waking up okay. They are waking up tired. They have concentration problems, behavior problems. Bill, being the orthodontist, when we look at just mouth breathing, from a dental point of view, it increases the chances of gum disease. In children, they tend to get holes in their teeth, even though they've got the most perfect diet and they've got the great dental care and brushing their teeth. They're at increased risk of getting holes in their teeth because of the mouth breathing. And when it comes to orthodontics, they are three times more likely down the track to end up needing braces. And when we look at kids that have the need for braces, somewhere between half to 2/3 of them, they have a history of not being able to breathe properly in their developmental stages. And those developmental stages of breathing weren't addressed as part of that being the same.
Yeah.
You're in luck because, believe it or not, a lot of these young kids lately, they want braces.
Yeah. It's kind of the thing.
My little girls ask me for braces.
Yeah.
I'm talking about train track braces.
Oh, yeah.
And I'm like, what do you want braces for? Like they want them as they're
kind of a status symbol. I mean,
it's the weirdest shit I've ever seen.
Yeah.
And I'm like, dang, dude, orthodontists are going to get paid because all these little kids want braces. They want them.
Yeah.
My kids are too young. We bring them in. They say, not yet. They're begging me. Can I get braces? Can we get braces yet? I'm like, why would you want them?
Yeah. And it's not all about braces too. You think about all the little things stuck on the teeth and they're lining teeth up and all that, but it's really more than that. Orthodontics is getting to be more about, we got to get the bones and the orientation of the foundations of the jaws correct. If a child mouth breathes a lot, one of the things that happens is their whole face becomes narrow and longer. You get this long facial pattern.
Get weird.
The chin tends to go back. Well, what happens when the chin goes back?
They don't
goes back in the airway.
They also don't get dates.
They don't. And
you ever see those no chin people?
Yep.
It's like,
I'll tell you something offline later that.
Well, I saw an Instagram thing the other day where it was showing all these, good looking celebrities.
Yeah.
And then it would put their chin back just to show how important a chin looks like.
Look at Beavis and Butthead. I mean, Beavis is, they have this dumbfounded look on them almost. But there was a study done about mouth breathing and nasal breathing. They took a group, a large sample, and they looked at functional MRI. In other words, functional MRI is like real-time MRI, not just a picture, but at the cellular level, really. And so what they did is they looked at mouth breathers versus nose breathers. And they looked for the intellectual areas of the brain that lit up. 50%, there's 50% less areas that light up in patients that mouth breathe versus nose breathe.
You want them to light up?
The more the better.
The more it lights up, the more the brain is working.
The more the brain is developing.
Where do people go for these tests? I've never even heard
neurologists.
of these
tests. So part of
no home tests.
Yeah, so part of what we're reflecting on in that discussion is what's done at a research level, because it's like you asked. You said, look, what's the harm? Well, the more we go looking, the more problems we find. So when we go looking at it from a body system point of view, okay, and this is in children and adults alike, okay, that children are more vulnerable. That's a really important take-home message. Children are far more vulnerable because they're in their growth and development stages. Brain. When we do these research studies on the kids' brains, look at the function, the brains are actually smaller, okay? And the parts of the brain that deal with things such as stress and anxiety, known as the amygdala, it's bigger. So, I'll see parents, they'll come in, bring their child and say, look, my child's not breathing properly, they're tired. And they'll say innocently, oh, look, I know it's got nothing to do with it, but they're prone to being anxious as well. And I'll go, well, actually, it is actually part of the problem because the parts of the brain that get bigger are tied in with the parts of the brain that practice something. The brain's stress response is practicing. It shouldn't be, but it is because it's not breathing properly. Your brain is going into stress mode and you're more anxious. And we see that too with mental health problems across the board, depression, anxiety, schizophrenia, bipolar affective disorder, PTSD. The list goes on. All those mental health problems escalate when this thing called sleep disorder breathing comes into the mix.
So how do you fix it though? So let's say what you're saying I'm identifying in my children, even though fortunately I'm not. But anxiety, that's where they all of a sudden feel like their heart's beating really fast.
Yeah.
Yeah. That's not good.
Yeah, none of this is good. This is all badness.
Yeah, so let's say I'm identifying this as you're talking. What do I do?
Well, what I'd like to do is build a foundation of knowledge. So let's build a foundation so we can sort of get another context of what we're talking about, because we can talk about how to fix it when we understand where we're at. So we've talked about mouth breathing and snoring so far. So people have probably heard of sleep apnea. That's a very common term that's out there in the public. That's what we would call the end stage disease. That's the worst of the worst.
Is it a disease?
Oh, yeah, absolutely. It's a diagnosed clinical disease, which can have a multitude of causes, and then the causes relate to the fixes. So we'll circle back there.
So it's a curable disease.
Depends on the cause. So let's go through how we get there.
You might say.
Yeah, let's see how we can get there, because it all depends. There's no cookie cutter approach. This is a very nuanced, technical thing that we'll work you through. So sleep apnea is the end stage disease. The mouth breathing is where it starts. Then the snoring kicks in, and then the struggle to breathe, but the ability to continue to do so until the point that you don't continue to do so. And that's when you start choking. That's when you get to the sleep apnea stage. What we do is we look at it from a daytime function point of view and a nighttime point of view, because we like to give parents, and this really is parent driven. It's the parents that are going to call this out more often than not, but they've got to know what to look for. So the daytime, okay, it's things like being tired, especially first thing in the morning. If your child wakes up tired and cranky first thing in the morning, you have got a serious problem, because those children that wake up tired in the mornings, they are the worst of the worst when it comes to this thing called sleep disorder breathing. If your kid is tired in the morning, in fact, anybody that wakes up tired in the morning has a significant medical problem. We can't tell you what that problem is, but it is a major red flag when it comes to healthcare. And then during the day, they can have concentration problems, behavioral problems. They can be emotional. They can get really upset, really angry. They can even have trouble with their physical capabilities. Like they can look like a really fit, healthy child, should be able to go out onto the sports field and run around for 2 hours, but within 10 to 15 minutes, they've hunched over, they're gasping for breath. That's what's called physical tolerance or exercise tolerance, and the ability to tolerate exercise. It's reduced in these children that can't breathe properly. When we look at the nighttime things, again, snoring and mouth breathing, stopping breathing at night, being restless, tossing and turning, sweating at night, sleepwalking, sleep talking, grinding their teeth.
Bruxism.
Yep.
Bruxism.
Yep,
Absolutely.
bruxism. The other nighttime things can be, like we said, having the head tipped back. All these things are abnormal, but they've been normalized in our society. You go watch some Disney movie, give you the perfect example, Frozen 2, that kid's in bed snoring. It's been normalized by society across the board. But if we go back in time when people understood this better and were aware of it more and noticed the signs, back in the 1800s, the scientific literature actually points out these things. It talks about children turning up to school that are mouth breathing are doing badly at school.
They knew this shit in the 1800s?
They knew this stuff in the 1800s.
That's
this is
the
not
sad
new.
part of this whole thing is
This is not
100
new.
and something years ago, we knew more about it then than we do now.
Yeah.
We've almost like we've gotten too smart.
Yeah.
Or we're ignoring it.
Or ignoring it.
Well, you'll love this. So back in the 1800s, you could get away with these things because political correctness wasn't floating around like it is today. So this is the name of the paper, okay? This is the scientific literature. This is the title of the paper. It's on the causes of backwardness and stupidity in children. It's the title of the paper. And they talk about mouth breathing back then. That was in the 1880s. Yep.
What about the kids that have those narrow palates?
Well, that's what we're going to come to. This is how this all builds together.
That's kind of where I
and this is where
I come
Bill sort of
into
jump in.
That's why orthodontists should be aware of it.
So I've talked to you about the symptoms. All right. Now they come and see someone like me. I'm the ENT. What am I looking for as a starting point? What I'm looking for is the common things that cause this, and we can talk about why they cause it. But the common things that cause this. In no particular order, big tonsils, big adenoids, nasal allergies, and a deviated septum. From an ear, nose, and throat point of view, they're the big four. And
how do you know if you have a deviated septum?
well, we're going to bounce through that too.
What deviates it?
Yeah, so we'll walk through everything. I love these questions. This is fantastic.
Great.
So tonsils and adenoids by far are the most common. Now, people hopefully know tonsils are things on the back of your throat. You open your mouth, tonsils on the back of your throat on the side walls. Okay? They're the tonsils.
Unless they were removed.
Well, if they've gone, then I've got one less problem to sort out.
So why don't they just remove everyone's tonsils?
They used to back in the day, and then antibiotics came and they thought antibiotics fixed everything. The problem is that it didn't.
Well, now they always remove molars or wisdom teeth, and now they're finding out wisdom teeth have stem cells that repair everything. So, like, why have they been taking them out?
Well, we can. Bill's going to be able to really explain that beautifully. But I'll round the ENT bit, and then Bill will run with that one beautifully. This is fantastic. So tonsils and adenoids are at the back of the nose. Okay, so the adenoids can get big. So looking at that, to look at the adenoids, I need to look through the nose. That lets me look at the septum, and my job's easy. Nasal septum, there's only two sorts, straight ones and crooked ones. Okay? Easy. Why did that get crooked? Trauma. It gets hit. It gets knocked. Even just from birth. We look at babies, first infants, newborns. About 5% of babies have a deviated septum. Now, some of them will self-correct, but others will persist. Or you're growing up as a kid, you're playing sport, you've got some rough and tumble, you come off your bike, you're playing football, whatever, your nose gets broke. Or you get into a fight, you get into an accident, your nose gets broke, trauma. Nasal allergies. So what happens with nasal allergies is the skin lining inside the nasal passages starts to swell up. As it starts to swell up, it starts to block the nose. So between that list of those four things, they're the main things that I'm looking at. In the process of doing that, I also want to know what the jaw structure is like. Because if we've got these problems going on, like I said, they're 3 times more likely to also have an orthodontic problem. The problem is the nature of those orthodontic problems. I don't care about crooked teeth in developing children. I care about jaws, and in particular, the 2 things we've actually already mentioned, the high, narrow palate and the jaw that's sitting back. So, Bill, you can probably speak better to that than I can.
Yeah, and if you think about when children mouth breathe, number one, the mouth's open, all the muscles are kind of squeezed. They're kind of narrowing up the face. Then you get this high arch palate. Now the roof of the mouth and the floor of the nose, guess what? Same bone. Just depends on you're on the second floor or the first floor. I'm looking at the ceiling, but if I go to the second floor, I'm standing on the other side. But as that palate starts to narrow up, the middle of it starts to go. It's a high arch palate. Where does it go? It goes into the nose. What's up there in the nose? We got your turbinates, you got the septum. So when the palate tends to go upwards, it's squishing up. That's one of the causes maybe of a deviated septum beyond maybe trauma. But it's just the anatomy of the way those jaws are. So that's why we orthodontists have, and I can say this because I am one, we've missed the boat we kind of think we're only in to do aesthetic. We're just a bunch of estheticians doing aesthetic treatment and straightening teeth and making people look pretty so they can get married and have children later on down the road. But it's more than that now. We are finding out that, these whole growth things start early in life. As David just said, even at birth, because it's a lot of this stuff starts even in women before they even get pregnant. Their nutrition, they get pregnant. Guess what? Gestational sleep apnea. In other words, women are going to get more weight put on them. You said, if you start gaining a little weight, you tend to do it. Well, that's what they do. So it affects their breathing at night, which affects the child potentially. But then even when the child is born, because of the way the child comes out, that can, most children that are natural birth, their heads are all squashed up.
That's a fact.
Yeah. And
comes out looking weird.
Yeah. Yep. I mean, and they but nature's supposed to take care of that. One of the things that is a big factor too is breastfeeding.
Good or bad?
Good. I mean, that's the way it's supposed to be, and not just for nutrition.
That also tells you that the women should be the ones doing it.
Should, but society has kind of changed matters for all sorts of reasons. But when you breastfeed, it's as much about the effort to feed. The child should really, really work hard to get fed. I mean, in other societies, they hand them a rib, and they're sitting there chewing on a rib and chewing on hard stuff, which, what does it do? It develops the bones. But now we're feeding them, baby food and applesauce and soft foods, which they don't chew, but they don't get breastfed anymore much because of also, just the way it is. But when they do that, and then what they do when they get bottle fed, what are you trying to do at night? You're trying to feed them as quick as you can so you can get them to bed, right? So what you do a lot of times, if the bottle's not feeding them more enough, they thinking it's just about nutrition. So what do? Take a pen and pop it in there and just almost pour it down their throat. So there's no effort there. And that effort is the effort makes the tongue go in the proper place to widen the palate and also move everything forward. One of the cures for adult sleep apnea, almost a cure, I'm going to say it's the upper management, is double jaw surgery. It's taking the upper jaw, moving it forward, taking the lower jaw, moving it forward. They also do a chin procedure, which brings the tongue forward. But all this is about bringing everything forward. So you think about it, when all the bones are coming forward, what's happening to the airway? It's getting bigger. Well, we ought to think about that in young children. That's the way the orthodontics should be geared toward, is widening and forward movement. And again, I can say as an orthodontist, because the way we were trained, we were graded on how well we could keep front teeth from moving forward. We were graded on putting headgears on people and moving the upper jaw back and not moving the lower jaw forward. And that's the way we were graded, is if we let the anterior teeth go forward any at all, you failed you failed in what you were doing. But now it's becoming more and more aware. Thank goodness, a lot of children now, when they go to the orthodontist, they're not going to get braces on at 5, 6, 7. Usually, it's arch expansion. It's expanders that expand the arch, and it's something, if they have a little gumpy lower jaw or a lower jaw that's not growing properly, it's to stimulate that lower jaw growth. Now, what if you have the other situation where the lower jaw seems to be ahead of the upper? Most of the time, it's the upper jaw that's recessive. you have to move the upper jaw out. It's not as much as the lower. If you have the reverse of that, where you have the upper teeth sticking out ahead of the lower, 80% of the time it's the lower jaw that's too far back and not the upper. But we've been treating the upper jaw by moving it backwards over. That's the way it's been trained. And unfortunately, now we're learning more and more with research and then combining efforts with ENTs to understand, they deal with the nose. We deal with this craniofacial region. Guess what? It's all tied together.
Yeah.
The ideal practice is to have an ENT and an orthodontist together.
Yeah, pretty much.
In a practice.
And early.
And early.
So you mentioned...
Is that how you guys met?
So, yeah, Bill actually hunted me down through a YouTube video that I'd done.
Yeah.
And that was probably around about 8 years ago now, 9 years
And
ago.
you guys train a lot of professionals on this.
We do the best we can.
Best we can.
And what we've found that makes the biggest difference is getting the mums on board.
But do they argue with you?
Yeah, of course they do.
They're like, bullshit, this ain't right.
Yeah. No,
a lot of academics,
Yeah.
they just... I'm getting a little bit off subject, but there was an article in our latest journal recently, in our orthodontic journal, that poo-pooed the whole idea about breathing, that orthodontists shouldn't be involved with breathing, or mouth breathing is not a problem, blah, blah, blah. There's a lot of things in there, but and actually there's a group of us that are going to kind of get together and not write a rebuttal per se.
It's not just the two of us. So we've got cardiologists, we've got neurologists, we've got a whole suite of medical experts that have reviewed that one person's opinion and found it so unfortunate as to how dismissive it was, that we've put something together which has got like 150 scientific references or thereabouts, just to explain why this one person was wrong. Because the problem is that person can influence a multitude of other people, just like we're trying to do.
Yeah.
But we're trying to highlight a problem that is in plain sight. And the reason it's in plain sight is this sleep disordered breathing thing. So I've talked to you about the history, the causes. This is 20% of children, 20. This is 1 in 5 children that have sleep disordered breathing. Sleep disordered breathing causes these problems. And for those people that are out there, also obviously with your audience, it's going to be adults, maybe men. Good number of those men are snoring, and some of those men will have a mouth guard that they wear at night that was provided to them by a dentist because of their snoring. And what does that mouth guard do? It pulls the jaw forwards. Why are they getting their jaw pulled forwards? Because the space inside their airway is inadequate. And often, if they have a look at themselves from the side, it's not the dramatic ones you were talking about, it's the subtle ones. That jaw is slightly back. Mm-hmm. When did that happen? In what point of that person's life did that happen? Before the age of 12. Because 80% of jaw growth happens by the age of 8 and 90% is by the age of 12. So by the age of 12, your jaw growth is pretty much established as to where it's going to be for the rest of your life. Mm-hmm. Okay? And this is the problem, is you'll go and see an orthodontist, say, like you said, they're too young for braces, because the mindset, okay, maybe not your daughter's agenda, but the mindset for braces and parents, my child's teeth are crooked, please straighten. That's the agenda. And they'll go to an orthodontist and they'll go, oh, we've got to wait until they're 14. By the time they're 14.
The age?
12 to 14.
12 to 14. So that's the traditional treating.
Traditional timing.
So and because that's the teaching, that's the paradigm. So you go, oh, I'll come back when they're 12, 13, 14, and then you'll straighten their teeth. And they'll go, oh, there's actually not enough room for me to straighten the teeth. I need to get some teeth removed to make some more space. Why is there not enough space? Because the jaws are not big enough. Why are the jaws not big enough? Because they were left to chance.
Well, it's too late then.
We're missing the boat.
So you want moms to pay attention right now, because
we want
before idea of fix before 6.
Yeah.
Yeah, but what if the mom is listening to this and she's like, well, I'm going in early, and our orthodontist sends them home again.
Yeah. So this is
happens.
This is part of the problem, and having a problem is you need to have a solution.
Yep.
So part of what you need to do is you need to be aware that there is two schools of thought. You need to know this as a foundation. And you need to realize that where we're coming from is about early intervention, because the best time to fix any health problem is finding it early. You were mentioning about your own personal journey. When was the best time for you to find that health problem? Before it was a problem. It is something that you picked up early, and it's something that you're either going to monitor or you're going to get fixed early, because the consequences are lifelong and serious if you don't. And this is, as Bill said, there's a mantra that's coming out. It's fix before 6. You want to be seeing an ENT and an orthodontist, but you need to see an airway focused one, not one that is breasted.
Can you just ask them?
You have to. You have to ask
a lot
them.
of them will
You have to
say,
you have to ask, do you see and treat children before the age of 12?
Yep.
And do you offer jaw expansion in the context of where the jaw is not growing and developing properly? Yep. And if they say no to one or the other or both, go somewhere else before you even go there.
It or something.
All right. There's no point even continuing the conversation with them, because it's going to be a dead end. Yeah. And you better call their office. Do they do these things? If they don't, that's easy. You just saved yourself a visit and a couple $100 on a consult bill that was going to be a dead end. It's the same with the ENTs. Do they see and fix children? Not all ENTs do see and fix children. And not all ENTs are going to be managing these sorts of things, because ENT is a big specialty. And from that point of view, you've got to choose the right ENT. But if you have a problem with your shoulder, you go, I've got a shoulder problem. I need to go and see an orthopedic surgeon. You don't see the orthopedic surgeon that specializes in knees. You go, hey, does your guy do shoulders? Okay, I want to make an appointment. Oh, they don't do shoulders? Okay, thank you for letting me know. And you just move on. Mm-hmm. Okay, so this idea of seeing an orthodontist, seeing an ENT, that's not the context. They've got to be these aware, airway focused, early intervention people, because this brings us to the next bit. You asked, how do we fix it? Well, the reason that we want to be here is the reason, so the way that you fix it is contingent on finding what the problem is. And these problems can evolve over time. Sometimes it starts with this, and then 2 or 3 years later, something else can come along that can interfere with things. So it can be a journey, it can be a process. But in the mainstay, the way that we fix this, if they're big tonsils and adenoids, in the mainstay, that's a surgical solution. If it's nasal allergies, that's environmental management, nasal medications, allergy shots, and sometimes surgery. If it's a deviated septum, the minor ones, maybe no big deal. The major ones, again, it's a structural problem, it's surgery. When it comes to jaw growth and development, if you're picking this up in 2 or 3-year-olds, you've got a bit of a heavy lift to get that child to cooperate. There's a few basic things that you can do, but really you're gravitating towards when they hit around that 6, 7, 8 years of age, you start expanding the jaws. And these are little appliances that go inside the mouth, onto the roof of the mouth, hook onto the teeth. They can either be ones that can be removed or ones that get fixed into place. There's different ones for different reasons, and they're designed to take the jaws out, open up the space. Okay.
Isn't that weird that just a little machine spreads your mouth out permanently?
Yeah.
So it's almost like, bones are malleable.
And it's really amazing.
Bones are malleable at this age.
But slowly.
Earlier.
At this age.
Otherwise they break.
Yeah. At this age, they are malleable. This is why you've got to get in before the age of 12, because if you don't, that's when you're looking at jaw surgery. And we're seeing teenagers that have been left down the road
because no one
having
knows
jaw
this stuff.
surgery. Well,
I've never heard of all this.
And this is why we want to bring it. Like I said, this is 20% of children. I can tell you, diabetes. Everyone in the public goes, oh yeah, I heard of diabetes.
So 1 out of 5.
This is 1 in 5 children.
Isn't that odd that it's 1 in 5 children that are afflicted, but there's 4 out of 5 doctors that agree? There's always one of them bastards that don't agree. And I was telling a doctor the other day, I said, he has a dental practice, as a matter of fact. And I said, I would call my dental practice the 5th dentist. I'm the one that never agrees with the other 4.
And look, it's not about being wild and off the cuff and being alternative. This is all founded in the scientific literature, and the problem we have.
How come the other ones don't find it?
Well, the problem we have with medicine in general. I'm sure it's the same in dentistry, okay? And I can give you some historical examples that just prove the point. We have a problem where at the time when it's discovered scientifically, gets into the literature, they've measured this, the lag time between that being established scientifically to flowing through and being mainstream clinical care.
10 years.
10 years minimum.
10 years minimum.
Well, and not only that, who funded that study? Number one. Number two, what did they want for the study to say? Because again, I always bring up the fact that doctors, everyone trusts them just implicitly. And I always say, listen, obviously that you guys know more than I do, but just because you say it doesn't make it true.
Absolutely.
So I always, A, get a second opinion.
Yep.
But B, like, look at the studies yourself sometimes, because wait a minute, this was sponsored by this particular
and the beautiful
group.
thing about
the beautiful thing about
and then now doctors are acting on it, and it's like, doctor, don't you realize what just happened? Oh, you're a conspiracy guy.
Yeah. Well, the beautiful thing about orthodontic management, ENT management, we're not contaminated by drug companies.
Well, what do the studies say about removing wisdom teeth?
Okay, let me. I'm gonna back up just a minute. I want to talk about the educational system, the way it, especially for an orthodontist, you go through 4 years of dental school, and then you go into the orthodontic, which is usually a 3-year program now. Okay, and I've talked to this before, and it's not a criticism. I've talked to chairmen about it, and they say, it can be a problem. The residents are there for 3 years to learn how to move teeth. And just historically, it's been, well, let's wait till all the permanent teeth come in and then we'll see them. So that's where all the educational part of it is, all this mechanical stuff and all these screws and springs and different kind of appliances, different types of wires and all this kind of stuff have evolved because we're bioengineers. Okay, that's kind of what we are, little bioengineers. But we got to learn how to move teeth. We're not going to see a 4 or 5 year or 6 year old child unless they've got specific cross bites or real deformity things, but you're just not going to see a quote unquote normal little child. Here's one of the things that is important for parents to understand, especially if you've got a child that's just got finally 2 or 3 years old, just got all their baby teeth in, okay? If all their baby teeth are all nicely lined up like little, and they all touch together and they look really good, guess what?
They're going to be
They're not going to have enough room. You want those baby teeth to be spaced out. The adage is really, you want a nickel. You want to be able to take a nickel and put it between every baby tooth. So if I get a 4, 5, or 6 year old that's got just pure baby teeth, to me, that's the perfect time to go in with these little expanders, because it's like butter. I mean, they'll just expand out. And guess what? You're making room for teeth later on down the road. But, oh, by the way, we're helping the airway and breathing. So the problem is, and luckily where I teach, we have started introducing, so we're seeing kids earlier. We're starting some earlier treatment, knowing the trick is that they want to treat all their cases and finish their cases within 3 years so they can see start to finish. Makes sense, right? But if you're going to see some early treatment, they're not going to stay there long enough to see it. So me, as I bring my cases to show them, I can show them, here's a 6-year-old, what would y'all do? Take an x-ray, look and tell Mom, you're going to need braces later. We'll see you in 6 months. We'll see you in 6 months. We'll say, okay, we'll wait till all the permanent teeth come in, then we'll deal with it. And that's usually the progression. Unless they have a cross bite or some major thing that they want to do early, they're not going to do much at 6 or 7 or 8 years of age. And like David said, 60 to 60% of facial growth is completed by 5 years of age, about 80% by 8 years of age.
So why wisdom teeth pulled?
Okay, here's my theory behind why are wisdom teeth impacted in the first place. God gave us 32 teeth. Guess what? It wasn't that long ago, few hundred years ago, we didn't have crooked teeth. And I'm not talking about going back to Neanderthals, but I'm just talking about if you go to some of the museums, Penn and other of these museums that have skulls from just a few hundred years ago, they had straight teeth. They had room for all 32 teeth. We got to assume if we look at the skeleton, we can look at the back of the nose, and the back of the nose is pretty big. So we don't know, but I mean, we got to assume that they're probably breathing through the nose pretty good. But the Industrial Revolution changed things a lot. Softer diet, women started going to work and not breastfeeding and blah, 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 blah on down the road. So we know the faces are getting smaller, the brains are getting bigger. I mean, that's just if you talk to anthropologists, that's what's happened. So,
well, I mean, Neanderthals have bigger heads than we do.
But smaller brains.
Smaller brains.
They had smaller brains and bigger heads, and now we're getting smaller heads and bigger brains.
If you think about the brain has taken up the space at the expense of this real estate.
At the expense of this, yep.
But the thing is, as Bill said, it's the Industrial Revolution. The diet changed.
It all changed.
If you actually go back, it was actually probably the invention of fire.
Yeah.
You know, if you go back around 12,000-ish years ago, when we started to work out fire meant that you could cook meat you weren't basically spending hours upon hours chewing on meat, which wasn't even cooked. It was just too hard. But then we started to soften it up. And as we started to soften it up, we could consume it more. And as Bill said, you go down the baby product aisle of your supermarket grocery store. All right. They are selling you foods that's been through a machine.
Because they don't want them to choke.
Yeah.
Right.
But how did children survive 300 years ago?
They didn't.
Well, they didn't because of infections and so forth, but they weren't choking on carrots. They weren't choking on celery sticks.
Well, it's probably because all they had was a tit till they were about 4.
Yeah, exactly. That's what you're supposed to breastfeed till 3 or 4 years of age.
How long until the bottle should be taken away?
Look, we're not going to be in the position where we're going to say that you shouldn't bottle feed because we understand.
Doesn't the bottle sometimes form the mouth weird?
It does. People have to absolutely understand that it causes problems from a jaw growth development point of view.
Get that bottle out by 3.
I'd be looking at pacifiers in particular.
Yeah.
Like next to no child should have a pacifier. There are some reasons, but next to no child. You never say never, never say always. But you want that pacifier gone by the age of 2.
Yeah.
If you got a 3-year-old walking around with a pacifier,
you have a 3 or 4-year-old's got a pacifier, it's going to change their jaw growth.
Yeah.
Well, what about because my daughter right now is 3 and she's like, I think just too old for a bottle. I mean, she can freaking talk. She has whole conversations.
Yep.
But she wants a bottle every single night before she goes to bed.
You need to chew. Chewing, gnawing on a rib. I mean, they're really not going to choke. I mean, you don't want to give them little M&Ms and things like that. That you want stuff that's on a stick or something. A corn dog.
Mine eats steak.
Yeah,
mine loves steak,
exactly.
but every night she wants a bottle, and I keep telling my wife, I think she's almost done with the bottle. Like I don't want her to get buck teeth.
There's no good reason that she should be going to a bottle. Now, what's interesting with the bottle, the pacifier, and for example, the thumb sucking. Okay, those 3 things that I just mentioned. None of my
kids have ever sucked their thumb. Isn't that weird?
But that's good. That's a good sign because those 3 things can also be an indicator of a breathing problem because it's part of what a child will do to hold their airway open at night.
Yeah,
they'll actually put something in their mouth to act as a prop. So that's another clue and sign that there's a problem.
Nature knows what it's doing.
And
what about mouth tape?
So really bad idea in children because 80 to 90% of mouth-breathing children have a physical obstruction through their nasal level.
Yep.
So you are literally suffocating your child. Like the mouth-breathing is your default backup option, and you're then going and occluding that, you're blocking that off. That's a really bad idea. It's actually the same in adults.
I was going to say, I don't like mouth tape.
And it's the same in adults until they've had an ENT clearance.
Yep.
Okay? Because again, if you have an accident as a child, when you're 3, you fall down the stairs, you break your nose, nobody even thinks about it. You're 3. You got nothing to think about. And you go through life with that crooked nose. And as you go through growth spurts, it gets worse. But you don't notice it from day to day. It's slowly getting worse over years and years and years until you hit a certain point, usually in your 40s and beyond, where you start to not feel like you can breathe properly. It's like, oh, it just feels blocked. It feels congested. And then you go, oh, you got a deviated septum. And you go, well, when did that happen? And I go, well, do you remember anything happening? And they go, no, I mean, my family talk about when I fell down the stairs when I was 3, but apart from that, there's nothing. And I go, that was probably it. But it didn't feel anything. You go, well, that's because you're used to it.
That's your normal.
That's your normal.
It's your normal.
It's not. It isn't normal, but that is that person's normal. Yeah. So I will frequently see adults who go, oh, they're absolutely convinced that they're right. My nose is fine. You go, it's actually not.
Can you see it with a camera?
Yeah, you can see it with a camera. I'll put it on the TV screen. So you see that. Or they've been through a clinic like Bill's where in the orthodontic assessment, they do facial scans as part of the assessment.
We have 3D imaging is what we have. We actually got the first what's called cone beam CT in the state of Alabama, which does, it's very low radiation dose. It looks almost like a panoramic x-ray machine that sits in a dental office, but it actually does a 3D image. And then another way is you can measure nasal resistance. There are ways to, and we do that on kids. Yeah. We can put them in this little machine and have them breathe through one side of the nose and breathe through the other. Then you objectively, because if you just ask somebody, how well do you breathe through your nose? Well, hey, it's normal to me. Yeah. But then you go measure it. It's like blood pressure. When you go to the doctor and you go, he goes, well, how's your blood pressure? You go, well, I guess it's okay. Okay, you're good. Check. What are they going to do? They're going to check your blood pressure.
They're going to measure it.
Again,
they're going to measure it.
They used to say blood pressure was this. Now it needs to be this. They used to say cholesterol needs to be here. Now they're saying it needs to be here.
And that's actually...
Like, who's right and who's wrong? How about just how do you feel?
Well, the problem is you don't feel high blood pressure until it's super high and you're about to stroke out. So you don't feel high cholesterol, but it contributes to disease. And what you're reflecting on is actually a really good point of reference because things always change.
Things change.
They have to. If things didn't change, we wouldn't progress. If things didn't improve, if we didn't have better ways and better knowledge and we were still doing things the way we were doing it 100 years ago, and we weren't learning and we weren't developing and we weren't evolving and we weren't accepting that what was right yesterday is now wrong, we wouldn't progress. So I can give you a perfect example when it comes to stomach ulcers, all right? So when I was at university, stomach ulcers were basically from drinking too much alcohol, taking anti-inflammatory medications, and the management was some medication that didn't work very well and major surgery. That was stomach ulcers. And then a group of people, they happened to be Australians, which, by the way, if you haven't realised, that's where I'm from, who said, no, we think stomach ulcers is due to an infection, all right? And nobody believed them. And they had to prove it. What they had to do is they had to give themselves stomach ulcers. So what they did is they had the telescope down inside their stomach and it looked perfectly normal. They deliberately dosed themselves with a bacteria called Helicobacter pylori, and the stomach ulcers came. And then they gave themselves some antibiotics to eliminate the infection, and the stomach ulcers went away. And still, at that moment, nobody believed them. Nobody could believe the fact that this disease that had been in healthcare and managed a certain way for decades and centuries probably was due to an infection. But now nobody even thinks about it.
Well, there's a lot going on with parasites right now. Some people will say parasites are the cause for bruxism.
Yeah, so that's a really good point too. So that is a thing that has actually been studied. Okay,
I know because I read just interesting things.
Yeah.
So I read about the wisdom teeth.
Yeah.
They're like, do you realize that inside wisdom teeth there's enough stem cells to correct this? Isn't it crazy? why they remove them. Well, again, that's the conspiracy side of people going, yeah, why do they remove them? They're trying to kill us.
Yeah. Let me clear that.
I can take blood from you, and there's plenty of stem cells in your blood to cure everything as well, or to do everything as well. Stem cells are everywhere. But this is where they're basically using a logical fallacy. So what they're saying is true, but their conclusion is wrong. It's like the sun goes around the earth. Why? Because I see it do it. That is totally logical. The sun goes around the earth.
Yeah.
I personally cannot prove to you that is wrong, but I have to accept there's some clever people out there that know more than I do that actually worked it out. The earth is going around the sun. Yeah, can I prove that to you, or do we just have to believe it? Technically, we just got to believe it.
Have an open mind is all I'm saying.
Yeah.
So maybe they're taking out the wisdom teeth because they don't want you to have crooked teeth. Maybe they're taking out the wisdom teeth because of some nefarious thing. Who I doubt it, but
well, I can tell you, I've had my wisdom teeth out, and I threw them out a long time ago in the jar they gave me to take them home with.
Don't they give them all? Because like I've had mine out. I thought you get your wisdom teeth out at some point.
Well, you kind of do it, in the 15, 16, 18. But let me tell you my theory behind why wisdom teeth are impacted in the first place.
When you say impacted
or
squashed,
they're they're not sitting straight up and down. They're jammed up under the second molars. As the brain got bigger, what happens? The whole facial component goes back. I think there's a relationship between impacted wisdom teeth and airway problems. Now, I don't know. It makes sense. Why would the wisdom teeth be impacted in the first place? Everything's got to be retrognathic or back. If it's more in the lower jaw. The lower jaw is the biggest problem because there's a big nerve that runs back there, and those wisdom teeth get jammed under that nerve. That's why they want to take them out in the 14 to 16 age group before the roots get fully developed. They want the roots to be halfway formed, enough where when they go take it out, they can if you just take them out when they're first developing, they're like a marble. If you try to take them out, all it's going to do is spin around on you. So you wait for the roots to start developing a little bit. Then when they go in there and open it up and pry it open, you have something to pry against. But if those wisdom teeth roots get fully formed, and then all of a sudden the nerves going through there, guess what? When you take them out, that's why a lot of surgeons sometimes they'll go, we're not going to take these out because I'm going to make your lip numb for the rest of its life.
But the nerves through there.
But it's a problem. So a lot of times they may go, it's not going to be a simple extraction. They may have to go cut the tooth up in a lot of little different pieces to take it out so they don't damage the nerve. Now in the upper, you don't have that problem. But you got a problem with the sinuses.
These are the things that go off track in children. These are why these children have anxiety, depression in children.
And that's real.
And that is real.
We see that.
Yeah. These are real experiences that they're having.
So what should the people listening? So the mothers listening, they should what? Go see an ENT and an orthodontist.
Yeah,
early.
Absolutely. Early.
Somebody's focused on Airway.
Early. And if they say, forget it, you guys, can they reach out or DM you? And
of course.
You guys should at least give referrals to legit ones or ones that maybe aren't legit, but they're like, what'd you call it? Airway specialist?
Airway focus. So for myself personally, I do the best I can. Like I pump out multiple bits of content. You got a book
coming out in 2026?
We've got a book coming out, which is for professionals. But I've got a multitude of books. So for example, we're talking, you mentioned Snore to Death. That was my first book. I've got one on this thing called sleep disordered breathing, but it's the parent's guide.
But these are all your findings?
Yep. Yeah. And then the one that I published 2 days ago, literally 2 days ago, was geared towards women. So the mums that are listening, and by the way, if it's dads that are listening, you need to get mum to listen to this because we know from experience mums play a bigger role in healthcare of
kids. They're moms.
All right, so mums for the win on this one. So mums, thank you for listening. But mums run into problems, especially when they start to hit menopause. So I 2 days ago published a book. It's called Female, 40, Fatigued and Forgotten. And the reason that is the case is that women, when they hit menopause, start to get the same rates of airway health disease that men have. Men usually start in their 20s and 30s, 40s. Women, it starts 40s and beyond.
Why didn't you add the other F?
Because I'm very diplomatic, but it did cross my mind.
You should have.
I should have.
See, we need to quit with the political shit.
Yeah,
like,
I hear you.
They're like, what's the other F? Fat's the other F.
Yeah.
Because again, when I get fat, I tend to start snoring.
Yep. And talk about that.
And if I start snoring for a certain amount of time, guess what? I would have been just fine had I lost weight, but I wasn't. Someone didn't say fat, so I stayed fat, and then now I started snoring, and then the snoring led to this. And next thing you know, I got a big issue because my airways were not clear.
And that's actually what I explain in the book, because you're a man, and our evolution on this journey of understanding started with men. And specifically, it was men that were overweight, having car accidents, not having strokes, not having heart attacks, having car accidents.
Because they were fat?
Because they were having sleep apnea. And sleep apnea, we didn't even know sleep apnea was a thing.
Yeah.
But these overweight, fat men were having what we call micro sleeps. They're having little moments where and that was all it took, and their car was on the other side of the road, and they were toast.
That's right.
Okay.
I've done it a million times where I'm driving and I'm like, oh.
And exactly.
There you go.
And women have been missed. This is why they've been forgotten, because women that get this aren't overweight. They're not male and they're not overweight. They have hormones that keep their breathing working better than men, but menopause mucks that up.
Wow.
And when the menopause comes in, the things that were just a little bit of a problem, that's when it escalates into being a big problem. And these women start to feel tired. They start to get brain fog. They develop insomnia. They're usually not doing much, if any, snoring at all. And it all gets fobbed off. Oh, you're a mum, you've got kids, your mother-in-law's just moved in as well. You're trying to balance the house and your career. You're just going through menopause. Look, this is all just normal part of transition of life. And they get fobbed off. And they don't have this problem diagnosed. They don't have these breathing problems diagnosed. And it's not until often they bring the child in. We start talking about the child and the questions start coming out and they go, do you see adults too? I go, yeah, usually because I think they're going to talk about dad. Because, that's usually, because dad snores real bad. But they go, because you're kind of describing me. And no one can work it out. And can you check me out as well? And go, yeah, look, of course I can. So we have this big problem again with how knowledge has evolved, because this knowledge started in fat men. These children are not fat that are causing the problems that I mentioned from the ear, nose, and throat and jaw point of view. Okay. Now, kids are getting bigger. That's a problem, and that's contributing to the problem. But historically, that's not where we're at. And in the journey, the women, mums again, you got missed. And this is what we need to change, because...
Well, at least you guys are open to admitting, as an orthodontist, as an ENT, hey, we may have been doing it wrong.
Yeah,
absolutely.
So again, that's what I call a good doctor.
Yeah.
Because if I was making mistakes and I learned, I'd say, wait a minute. And they're like, well, you were saying I made a mistake, brother.
Yeah.
My goal is your health.
Yeah.
A lot of them won't admit it, or they don't see the forest for the trees, or they don't want to know.
Yeah, they're closed-minded. I was taught, I got my degree, don't worry about it.
Yeah.
I'm the expert.
I'm a doctor.
Yeah, I've already done the heavy lifting. I know everything.
There's misdiagnoses all the time.
Of course there is.
And one of the third largest causes of death from some study I was reading is doctors' mistakes.
Correct.
So it's like,
right.
Guys, doctors definitely know more. You break your arm, go see a doctor. You got problems, go see a doctor. But listen and pay attention and do your own research. And listen to doctors that are, what I would say, opening everybody's eyes to, hey, we're finding that airways, the way you breathe and sleep is affecting all these other things.
It's the first thing you do. It's the first thing you do when you're born. We're looking at HHS in the United States. We're looking at, Make America Healthy Again or whatever. And what we're concentrating on now is nutrition and exercise, because that's the two big factors. Eat well and exercise, and everything's going to be great. Guess what? it starts with breathing. That's the first thing you do when you're born. You breathe, then you eat, then you sleep, and then you move around. And that's the way it ought to be. Breathing, nutrition, sleep, and then movement or exercise, because they all go together.
That's a bomb right there.
Drop the bomb.
Well, those are all critical. Like when someone really wants to get healthy, you got to look at your sleep.
Yep.
All of
You got to
it.
look at your diet. You got to look at your mobility.
Yep.
Yeah.
All of the above.
All those are important.
If you don't sleep properly, you actually don't eat properly. Your food-seeking behaviors change. You will go towards things that are more sugar-laden because you're basically in that brain fog, okay? And it's like, I just need some energy to get myself through this.
Yep.
And the quickest energy source comes from sugar, and they've proven this. The other thing it does is this sleep-disordered breathing thing. It leads to low oxygen levels throughout your body. It changes your gut bacteria. So it shifts
microbiome.
the microbiome. It changes, and
They're
we have
finding
known
more
this.
stuff about that now.
Well, I wrote about this in my first book. I wrote this book in 2016. I was talking about how the scientists, again, showing you the lag period problem, the scientists of the stuff that I was referencing in that book were talking about these gut changes being evident. They did it in animal models where they deprived it of oxygen just a slight amount and measured what their gut microbiome was doing. And the way they could measure it, 2016 was far more crude, in terms of the sophisticated ways we can check it now. But they were finding changes, and it wasn't changes for the good. It was changes for the bad, and the type of bacteria that was starting to thrive in an environment of an animal. And we're animals too, and we see it in humans now too because we've advanced the cause. It changes it towards things that lead to metabolic dysfunction. It leads to inflammation. It is leading to dementia. It is leading to a whole range of problems simply because at the end of the day, you didn't breathe and you didn't sleep properly.
Folks, I think what they're saying is you need to breathe, you need to sleep, and most importantly, you need to look at your child because that's where it begins and can be prevented most quickly. And the ladies,
It's what our book that he and I are in the process of getting through. One of the editors, another one of the co-editors, by the way, is Dr. David Gazal. He's a pediatric pulmonologist. He's the dean of the medical school at Marshall University. Dr. Gazal now is the most prolific author in the world on sleep apnea and sleep-disordered breathing. And a lot of his research that he's doing is on gut microbiome. That's what he's doing now. Mm-hmm. So we got cardiologists, neurologists, and that used to be the head of Stanford Sleep, and we got a lot of heavyweight. I've got 30-something co-authors with 45 chapters. This is a medical dental textbook that we're putting out. Unfortunately, like chasing cats to try to get everybody together, but we're almost there.
well, what can the Bomb Squad do to help you out?
Well, we want to highlight to parents that at the end of the day, it's no good having knowledge if you don't act on it. Right. And for those people, there we go.
I should have been dropping them the whole time.
Let's start firing them off. For those people that have just come in and listened to this moment, and this is all new, feel free to fact check me. We've got AI machines now. Look it up. Does sleep-disordered breathing affect a brain of a child? It'll tell you, and it will tell you in graphic detail if you ask it to, how devastating it is. Does it affect their gut? It affects everything.
Well, if AI knows it, how come all the doctors don't?
Because again, it's if you want to acknowledge that you were wrong, you need to put your ego to the side. Mm-hmm. Oh, come on. You got to hit the bomb on that one.
Got to hit it.
All right. Now
You just beat me to it.
Now I'm calling the shots.
Folks, and by the way, I know I have doctors listening, dentists listening. I know that for a fact. Listen, reach out, educate, learn a little something. You can always disagree and deny later.
Absolutely.
But for now, freaking reach out to these guys, parents, moms, get your kids early in, find doctors that are like progressive. And, you guys are the good doctors.
Well, thank you. And then down the track, we'll have Airway Breathing Academy. We'll have an online resource so that parents have some sense of understanding and guidance so that They can use what we've shared to basically start getting some answers to questions that have been left unanswered.
And not only that, if I were a professional, it's just more business. If you pick up and find something new, well, now you got a whole new thing you can do.
Yeah.
Well, at the end of the day, as much as it can be business orientated, most of us really are there for the benefit of everyone else. And the best way that we can do that is it's no good us knowing this and keeping it to ourselves. It's not like a secret sauce recipe that we're not going to tell anyone else about. We want everyone to know about this. Yeah. We want them to.
Well, everyone does, because now I think everyone but 2 people in Somalia and 1 in Bangladesh listen to this show.
All right. Well, we'll tap them on the shoulder later on. But for the meantime, everyone else, you got to be on board.
Yep.
Folks, get on board. And as always, stay healthy and keep it real. Thanks for coming, gentlemen.
Good. Pleasure.